Okay. Hello, everyone. This month we've been talking about healthcare, and specifically, we've been given tips on how to easily access healthcare and navigate the healthcare system. And I remember when I worked in an insurance-based medical clinic, and a patient wanted to leave her corporate job and start her own business. But even though she was stressed and many of her health concerns were actually due to her job, she didn't want to leave because she was concerned about healthcare. Her employer was sharing in the cost of her care, and she was worried that if she left, she wouldn't be able to cope with the costs. So you're listening to Connecting the Dots with Dr. Ashaye. I am your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land. We're an innovative medical clinic, and we offer an alternative way to receive health care that is holistic, stress-free, and focused on the patient. So before we get into it, though, if you've not yet subscribed, go ahead and subscribe to this channel because it helps us get the word out so more people can get this information. Okay, so as I mentioned earlier, healthcare is a huge concern. It's a huge challenge, especially for business owners and those aspiring to be entrepreneurs or do something independently. And unfortunately, the healthcare system today in the US is broken. And honestly, many people have lost faith in the system because the truth is the traditional health system does not serve the patient. So in order to get quality healthcare, it's important to think outside of the box and learn the truth about what is available to you. So what options are available for small business owners or aspiring business owners? So first of all, if you aspire to be a business owner and the only reason you haven't stepped out is because of health insurance, I invite you to explore your options. Don't assume you can't make it work. It's important to know that while your employer may be helping you cover your insurance costs, that cost is built into your benefit package. So remember, they are also running a business, and so it has to work, right? The health insurance money is money that could have been paid to you, but your employer is paying on your behalf. So the truth is you do get less money because they're paying for your insurance. So it's a whole total package. So when you are in an employer plan, they are choosing your health plan because they're paying for it, but that health plan may or may not work for you. So it also means they're helping you choose your doctor and where you can go to receive care. So it's good to just understand that by having your employer cover your insurance, it comes with a price. So just be sure that it actually works for you. But if you're a business owner already and you are delaying your care because you're not aware of what options are available, or maybe the traditional option that you looked into was too expensive, I encourage you to keep listening. So because today we're going to be exploring one little known option for healthcare, especially for small business owners with or without employees, for entrepreneurs, for 1099 contractors, and we'll go into some detail. And this option, I believe, is one that all business owners should explore, and that is direct primary care. And I'm going to tell you why soon, but let's first talk about direct primary care for those that may not have heard about it. First of all, direct primary care is not health insurance. Health insurance is more like a promise to pay for healthcare. It's like, okay, you set aside money. We promise you that when you do need healthcare, we will cover some of that cost. Direct primary care is different. It's not a promise. It's actually healthcare. It's a model of care where the business owner or his or her employees can have direct access to their own personal doctor without breaking the bank. So with direct primary care, you pay money and you get health care, not a promise. You actually get the care you actually cared for. So that's the difference. So why direct primary care for business owners? Well, time and money are the most valuable assets for a business owner. And the flexibility built into direct primary care model makes it perfect for a business owner. Because when you join a direct primary care practice, you can call or even text your doctor directly, regardless of where you are. You can have a video visit when it's appropriate. If you're not available to come in, you can schedule a same or next day appointment instead of having to wait weeks to be seen. And when you come into the clinic, you don't have to wait for long periods of time before you see your doctor. The doctor's schedule is not overbooked, so you are typically seen within minutes. So because of this flexibility, the easy access, it makes direct primary care really a perfect option for business owners, for entrepreneurs, and for their employees, because you save a lot of time not waiting to be seen. It's very convenient. You can spend your time doing what you want, what you care about doing, instead of wasting time with inefficient healthcare systems. So your employees can get back to work sooner because they can actually get the healthcare that they need. So I hope that addresses, the time issue, the convenience issue, which honestly, all people have that issue, but particularly business owners face that with healthcare because time is money, right? So you may be asking, okay, right, it's good timing, it's convenient. What about the cost? Or what about if I have to see a specialist or emergency room or I need surgery because, you're talking about primary care. So I'm going to get to that in a second. We've established that it's a great option if you're seeking convenience and flexibility. But before I get to the cost and how to pair it with other things, I want to talk about another reason that direct primary care is perfect for business owners. And this reason is often overlooked. And that's because with direct primary care, your health is given the value it deserves. So what do I mean? As a human being, one of the most valuable assets we have is our health. But as business owners, this becomes even clearer because especially when you first start out, the business is really you. So no matter how great your business is doing, without good health, you cannot be productive. And you really don't want to leave your health to chance. You don't want to delay your care, waiting until you quote unquote make it, and then find out when you get where you're going to your goal that you cannot enjoy the fruits of your labor because of your health. So unfortunately, today, primary care has been completely devalued. I mean, people don't even understand what primary care is supposed to be anymore. And that's why a lot of people just kind of treat healthcare, as though it's, as needed, right? So they just walk into an urgent care. They just go get random labs when they think maybe something is off. Maybe I should just check my iron and see if that's okay. Or they may go to a mini clinic or a random primary care and pay clinic and pay cash. The problem with that is not primary care at all. That's just reactive care. That's really just waiting for something to happen. If primary care is done right, 80% of healthcare can actually be addressed within primary care, or even more than that. And the issue is that most people don't get true primary care. They're just getting reactive care. And then later they find themselves spending tons of money to treat something that could have easily been prevented. Primary care is more than just having your yearly physical. The yearly physical, your doctor talks to you maybe 10 minutes and you're out. That is not primary care. If it were just money that, you ended up spending more of later because you did not get foundational primary care, that would be fine, right? But the issue is the person typically also pays not only with money, but with time and with pain and suffering. So primary care needs to be taken seriously because with good primary care, it makes a huge difference. So direct primary care is perfect for business owners because it helps them prioritize their health now. So when you find a doctor that will actually take the time to get to know you, which we have the time in a direct primary care practice, that will focus on preventing health conditions, not waiting for you to contact them before they actually tell you, how you should best care for yourself, not waiting for something to happen before acting. One that would actually partner with you to optimize your health so that you can be on top of your game. When your care is disjointed and you're just going anywhere and everywhere to receive care from anyone, something could very easily be missed. So as a business owner, direct primary care really helps you with that. It helps you not to wait, helps you not to trivialize your health because you're getting personalized care, and so that you can value your health now. So that's another reason, why I believe direct primary care is perfect for business owners, because business owners sometimes get carried away with their businesses, and so they kind of delay their care. So it saves time. It helps you prioritize one of your most valuable assets, which is your health. Okay, so the third reason I'm going to share today about primary care, which I talked about earlier, is cost, right? I mentioned earlier that time, money are very valuable to business owners. Access and cost of healthcare are also the biggest challenges in today's healthcare climate, especially here in the US. So direct primary care addresses both because, first of all, by saving you time, direct primary care saves you money. But also, direct primary care saves you money in other ways. Okay, so business owners can significantly save a large amount of money by using direct primary care for themselves and or their employees. And how? Well, first of all, we talked about the easy access to a doctor. So that automatically means that you and all your employees don't have to miss work, since your health issues will be addressed quickly, and you and your employees can go back to work much faster. Also, since it's a doctor that knows you well, not some random doctor or other provider, you are actually much less likely to have complications. You may have experienced this, when you go to an urgent care to get something, maybe that didn't work. You go to another urgent care to try something else, it doesn't work, or maybe you get a side effect, and then you can't follow up with anybody. All those things are less likely to happen when you've seen one doctor who knows you, and it makes it a lot easier to access care and figure out what to do, because you can follow up. You can come in the next day and the next day until everything is sorted. In addition, you are less likely to go to the emergency room, the urgent care. I cannot count how many times that I've been able to prevent an emergency room visit for our members in our practice. Some with pain, some with an infection, dizziness, high blood pressure, but because they can actually call or text, or they can actually reach me when needed, they can get the care that they need. It saves them hundreds or even thousands of dollars, because the truth is one emergency room visit can actually pay for one whole year of membership in some cases. So easy access to care equals saving money. So that's one way. The other thing is that a lot of direct primary care practices understand how to navigate the health system, because we're outside of it and we've been in it before. And many of them are owned by doctors, so they're in tune with the needs of the patient. It's not a business, you're not just a number. So since these doctors are also not contracted with the insurance company, they work for the patient, not for the insurance company. So the incentives are aligned with that of the patient. So all these things are important, because when doctors in a direct primary care practice are looking for ways and looking for things that benefit the patient's health. So as a result, they typically have a lot of perks within their programs. They have discounts. They know of programs in the community that can be beneficial. They know of places that people can go that cost savings. Pretty much they go the extra mile to make sure that their patients get quality care without breaking the bank. So they are less likely to just pass you off to a specialist. They have the time to evaluate what's going on with you, or just send you to an expensive imaging facility without thinking about, the cost implications. So as a result of just being part of a direct primary care practice, you save actual cash dollars, because people are aware of all those things and they understand how to navigate the system. So the other reason that you save money within a direct primary care practice is we work under a subscription model. So people become a direct primary care patient by paying a flat membership fee. And every practice structures this differently. It's not like a franchise or anything. It's like each doctor has their own practice, and they can structure it however they want. But for example, at our practice in Touch Primary Care, we're based in Sugar Land, Texas. Our fees can be paid at once for the year, or it can be spread out by paying monthly or quarterly or biannually. And that helps people to be able to plan ahead of time for their healthcare costs, which is very valuable if you're a business owner. You're not worried about getting a surprise bill. You know exactly how much you're going to pay for the year for seeing your doctor. And that helps. Also, because you can come in as often as you need, you don't have to pay a copay, co-insurance, or any additional fees. You won't delay your care, right? Because a lot of times people would delay their care because they don't know how much it's going to cost. So when you actually compare how much you spend on membership and personalized care you receive as being part of a primary care practice, like a direct primary care practice, and a lot of business owners tell us they're paying significantly less. And when we've talked to insurance agents that can help them pair our membership with other health plans, they have said that they are paying, business owners end up paying significantly less than if they go with a traditional healthcare system. So you're paying less, you're getting better care. It's a win-win. So that's another reason why, you're able to spend less time, less money, you're able to prioritize your health. That is why DPC is perfect for business owners, for entrepreneurs, for 1099 contractors. So as a business owner, if you are wondering, what can I do for healthcare? I encourage you to look into direct primary care. And I've talked in episode 66, episode 67 on connecting dots to Dr. Ashaye. And then there's a Solving Healthcare podcast with Mike Andrade that I also did on our YouTube channel. I've discussed there with these agents and with these people how you can pair direct primary care with other insurance or non-insurance health plans so you can get comprehensive health care. So be sure to check out those videos too. Well, thank you for listening. Remember to subscribe, to share, to like. Please share with an entrepreneur, business owner, 1099 contractor, anyone that may be delaying their care. You never know, it may make a huge difference for them. So that's what we have today. Have a great day, and I'll see you next week on Connecting the Dots with Dr. Ashaye.